We know that COPD, or chronic obstructive pulmonary disease, is a progressive disease known for resulting in damage to the lungs that gets worse over time, making it more difficult to breathe. COPD is actually the umbrella term for chronic bronchitis and emphysema, both lung diseases. Now we are learning even more about the impact COPD can have on you both today and in the future. A recent study published in Thorax, an international journal of respiratory medicine, found that not only does COPD reduce your quality of life in the present, but it can also shorten your overall life expectancy by causing excess wear and tear on the cells in your body. Researchers studied blood samples of 46,396 people and determined the amount of each person's state of cell erosion by measuring the length of their telomeres, the ends of chromosomes that protect each cell's DNA. As you age, your cells divide. Each time they divide, a piece of the telomeres is cut off until there is nothing left. Once the protective tips have disappeared, the cells stop functioning, ultimately leading to organs shutting down and death. This process occurs naturally over time, but the study demonstrated an accelerated rate in people with COPD. Why does this happen? Smoking is the most common source of COPD, but the disease can also be caused by genetics or long-term exposure to other lung irritants such as pollution, dust, or chemical fumes. As COPD progresses, damage to the lungs makes it more difficult to breathe. People predisposed to COPD, this damage accumulates over time, leading to progressive loss of cells, says Antonello Puntarelli, MD, PhD, Program Director and Medical Officer in the Division of Lung Diseases at the National Institute of Health's National Heart, Lung, and Blood Institute. The final result is an organ, the lung, without the capacity to sustain the respiratory needs of the body. In addition to immediate damage to the lungs, COPD causes damage to other parts of the body by way of a downstream effect, explains Keith Robinson, MD, MS, a member of the COPD Foundation Clinical Advisory Committee, CAC, and a board-certified pulmonologist and critical care medicine intensivist at North Broward Hospital in Florida. White blood cells are produced in response to damage that occurs because of COPD inflammation. In order for these white blood cells to be created, existing cells must divide, causing more damage to the telomeres and making cells wear and age faster than they normally would. A direct impact on life expectancy. Research shows just how much COPD can shorten life expectancy. A study published in the International Journal of Chronic Obstructive Pulmonary Disease quantified the number of years lost. Researchers found that the later the stage of COPD, the greater the shortened life expectancy, and that people who still smoke lost the most time, 5.8 years in stages 3 or 4 of COPD compared to 1.3 years in people who never smoked. While not faring as well as non-smokers, those who quit smoking had a better life expectancy than those who still light up. The impact of COPD on life expectancy varies for each individual, adds Drive. Puntarelli. Some rapidly lose their lung function, while for others, it takes longer. In addition, the presence of other conditions will also influence individual lifespan. The impact of COPD-related health concerns. The possibility of potentially serious health concerns occurring alongside COPD makes it necessary to focus treatment on more than just improving airflow to aid breathing. Along with experiencing flare-ups and the inability to exercise, many with COPD are malnourished, and their weight loss can lead to muscle deterioration, impaired health, and death. A study of 424 COPD patients found that healthcare costs for malnourished patients were higher than costs for overweight or normal weight patients, primarily due to an increase in the number of times the malnourished patients had to go to the emergency room for treatment. Researchers believe it is important to measure muscle mass as part of routine checkups in order to better monitor the overall health of COPD patients and improve their quality of life and life expectancy. The link between COPD and other health conditions has been identified in multiple studies. A study by the American Thoracic Society found that people with COPD are 2 to 5 times more likely to develop lung cancer than smokers who do not have COPD. A study published in the European Journal of Epidemiology showed that people with COPD have an increased risk of cardiovascular disease. Another study, published in the journal Therapeutic Advances in Respiratory Disease, identified a varied list of additional medical issues: malnutrition, osteoporosis, anemia, muscle deterioration, kidney abnormalities, and hormonal abnormalities. Vitamins and Hormones published a study that explored the connection between vitamin D deficiency and an increase in severity of COPD, as well as with the prevalence of osteoporosis in COPD patients. It is important to work with your healthcare provider to develop a treatment plan that focuses on all aspects of your health in order to achieve and maintain the best quality of life possible. Ways to be proactive and stay healthy. Yes, COPD can reduce your life expectancy. If you do not properly manage your symptoms, the risks for complications increase. But if you are proactive, you can help keep your body healthy longer. Good nutrition, quitting smoking, regular exercise, use of recommended medications, and taking care of other conditions are all expected to improve